up guys? So in this video we'll be talking about symptoms of Ebola. It is very important to learn about the symptoms of Ebola. In this part of the video I'll be covering the symptoms. Ebola's symptoms should be taken very seriously. Early Ebola symptoms include fever, headaches, chills, sore throat, intense weakness, joint pain, and muscle pain. Later symptoms include nausea, vomiting, diarrhea, red eyes, rash, chest pain, and both internal and external bleeding. As day 11 approaches, the symptoms become more serious, include brain damage, loss of consciousness, seizure, and even death.
So I'll be talking about Ebola virus prevention. First of all, Ebola virus disease is really rare in the United States, common in some parts of the sub-Saharan Africa, with occasional outbreaks from infected animal transmissions. What to avoid? Avoid contact with blood and any body fluids, such as saliva, breast milk, sweat, urine, feces, semen, and vaginal fluids. Also avoid items that have any contact with blood and body fluids, such as clothes, bedding, needles, and medical equipment. Contact with bats and non-human primates infect raw meat and blood should be also avoided. Are there any vaccines for Ebola virus? There are no currently vaccines licensed for the FDA, and there's still ongoing research. How to control an outbreak? First, find people who might have any contact with infected persons. Watch them for 21 days. If Ebola signs shows, test, treat, and keep them away from others.
Hello guys, this is Sahar and I will talk about Ebola treatment. First of all, there was no treatment available until 2015. After that, there was supportive therapy and experimental treatment available for patients who have Ebola disease. Many people showed recovery in West Africa after getting the treatment, and during the treatment process, the patient should be completely isolated so that the disease doesn't spread to the physician in the hospital and other people. And physicians should wear goggles, should wear gloves, should cover all of their body so that they cannot get the infection. Supporting therapy includes providing the patient with intravenous fluid because of the dehydration. Also, maintaining the oxygen status and blood pressure of the patient and balancing the electrolytes, the body salt of the patient. Experimental treatment includes vaccination. Vaccinations are Brincidofovir, plasma, ZMapp, and JSK vaccine.
The Ebola virus is said to originate in bats. The bats then transmit the virus to other animals and cause them to become infected as well. The virus is transmitted to humans when they hunt or have direct contact with the infected animals. Once the human is infected, the virus will begin spreading rapidly and will ultimately cause an outbreak. Ebola is very selective in the way that it can be transmitted between hosts. It cannot be transmitted through air, water, food, or mosquitoes, which are very common disease transmission pathways. The ways Ebola can be transmitted are through direct contact with the infected human or animal, or exchange of bodily fluids like blood, vomit, or saliva. This clip shows the virus entering the host cell and interacting with the nucleus. You can clearly see the unique shape and structure of the Ebola virus as it interacts with the cell. In order to prevent transmission in the healthcare professionals that are sent to deal with the outbreaks, they're advised to wear hazmat suits that completely isolate them from possible exposure. They also step in buckets of bleach upon entering a new area in order to prevent possible transmission if the virus was acquired on the suit.